This is a news article that just came out on HR Dive. As opioid hit the workforce, employers are forced to improvise. As the baby boomer generation retires out of the workforce, many companies are struggling to fill open positions in areas of countries where illicit drug use is rampant. The opioid plague is doing more than destroying individuals and families. It's threatening to shut down manufacturing plants and whole industries as employees and potential hires succumb to drug abuse and addiction. The opioid plague has had a staggering effect on workforce participation, particularly for men ages 25 to 54 at 88.4% participation. The amount of men in the labor force pool is only slightly higher than its all-time low in 2014. Opioid use has become a key factor why prime age workers, primarily men, are unwilling and unable to find work, according to Goldman Sachs economists cited by CNN. In a study published by a former White House economist, approximately 1.8 million workers did not participate in the labor force at the beginning of 2016. Almost half of respondents, over 880,000 individuals, admitted they had taken an opioid the day before being surveyed. For American employers, the situation is becoming dire. Some reported that between 25% and 50% of qualified applicants can't pass a routine drug test. For those in the manufacturing industry, a sector in which diminished capacity can be fatal, employers simply cannot take the risk. Jobs remain unfilled, new orders are refused, and the toll of opioid abuse trickles throughout the company and the community. The CDC reported that more than 15,000 opioid deaths in 2015. Cost and hidden cost. According to a study by Castlight Health, 1/3 of prescription painkillers paid for by employer-funded plans are being abused. Workers who abuse painkillers cost the company double the medical cost of non-abusers. Across the country, it's estimated employers lose $10 billion per year due to lost productivity and absenteeism because of drug abuse. Companies are also seeing increased insurance costs due to the plague, covering the cost of health insurance for employees and families. One company in Ohio had to spend $250,000 in the last 3 years for drug treatment for 5 employees' dependents. Wow, that's a lot of money to shell out for just 5 people. An additional $300,000 was expanded for 3 months for neonatal intensive care treatment for a family member who gave birth to an opioid addicted child. Yeah, and they said they are the most expensive addicted babies to treat in the hospital, and they got to stay the longest. Okay, pre-screening on the rise. Carl Johnston, president of Clear Match, an employment screening and investigative company, noted that striking difference in requests for pre-employment drug testing. In the last 4 months, we have seen a 30% increase in employers asking us about drug testing, he said. Normally, employers are concerned if the applicant has a criminal record or a credit risk, but now they are concerned with on-site drug use even the jobs that are at the executive level. Yeah, because it's people of all backgrounds, from the poorest up to the richest that are doing the opioids. In the past, opioid testing was an option for most drug screenings, as employers believe it could recognize a heroin user. And you know what? If they find any drug use in your background now, they won't hire you. A lot of these drug addicts, even if they're former drug addicts, if they find that you've been arrested on any type of drug charges, a lot of companies nowadays will not touch you. You can even go there and say, look, I'm clean. I don't do drugs anymore. They don't care. They won't touch you. I think they look at them as a risk. There's always that chance those folks are going to fall off the wagon, and they don't want to take that risk. Today, because of the access to prescription opioids, employers are stressing the need to test for the substance during pre-employment screening. Johnston finds 20% of those screened are not passing the test. Further complicating screening are states where recreational marijuana use is legalized. Employers are placed in a difficult situation because the drug lasts for weeks in the system. It's impossible to discern whether the applicant used drugs over the weekend or on their way to the testing. For manufacturing jobs particularly, the risk is too high to hire. For current employees, Johnson adds, opioids are a serious concern. So much so that we are seeing an uptick in employers asking us to do random drug testing. We received 141 requests for a random drug test for the month of July. Okay, the crisis is so significant that the Trump administration launched a presidential opioid commission, which is doing absolutely nothing to study the effects of opioids. Well, they have declared it an emergency, but they have given absolutely no funding. It recommends waive limits on Medicaid access to residential addiction treatment, expand access to alternative medicines that treat opioid addiction, suggest legislative measures, and provide naloxone or Narcan, a drug that reverses opioid overdoses, to police. The commission will continue to study the matter. The New York Times reported that at the Ohio manufacturing mentioned above, Warren fabricating and machining, 40% of applicants are disqualified from employment based on a failed drug test. In response, it created an apprentice program, deciding it was worth the time and money to train sober candidates instead of continuing to come up empty-handed in its search for skilled applicants. Wow. Another employer, ThyssenKrupp, this is where my father worked, North America, told Times that it has turned to staffing companies to pre-screen workers. A third, a roofing company, has partnered with a nonprofit that provides opioid treatment and job training. Another Ohio manufacturing told LinkedIn that it doesn't even bother taking job ads down anymore. Turnover is so high because of opioid abuse that they need a constant flow of applicants. Wow. So even when they have these people hired, they have a problem with, a flood of turnover where they got to constantly hire more, probably hiring more opioid addicts. But it's also working on more permanent creative fix working with engineering students at a local college to develop machines that can automate tasks, drastically reduce the number of human employees needed. Still more have found success working with parolees who may be required to remain drug-free as a condition of their release. Wow, that's a damn shame. Woo! For many employers, hiring unskilled workers using an employment agency for factory floor jobs or actively seeking out former addicts would have been unheard of in the past. Now, however, they have few other choices. The problem is so deeply entrenched in pharmaceutical, insurance, and healthcare policies, meaning solutions will be tough to implement. But employers are already working to get more involved in healthcare in order to bring general costs down. Companies may soon be stepping in as key partners as various groups seek to end the plague, the drug plague that's going on. You know, if productivity is down because of this epidemic, that means that's less money coming into the economy. So, as I stated before, this drug plague has a domino effect, and it's really impacting everything from jobs to schools, all types of public places are all feeling the effects of this plague. It's not like it's a small group of people and they're just causing harm to themselves. It's impacting all of us. Please leave your comment and subscribe. And if you can donate to my channel, please do. Peace, family.